I received a call from my child's school that she was not feeling well. She was having a sore throat and an ear pain.
We check their vital signs, ask them what's wrong. One of the goals as a school nurse is to keep all of my students in school and healthy.
As a full-time working mom, it is hard to get off work at the last minute notice.
School-based virtual care has the potential to really affect a student's grades and their attendance. A lot of times that student can be seen that day for that problem and not even miss a day of school. The turnaround time for their illness is usually much quicker.
The parents are able to participate just like they would be if they were in an office here. So even though you're separated by many miles, it feels as though you're sitting in an exam room. Families can be involved and there can be minimal disruptions to both the child's and the parent's life.
I saw everything going on in real time, and I knew my child was in great hands. During the virtual experience, the Levine Children's provider was very comforted and caring for my child, and that means a lot to me. At the end of the virtual visit, we had a diagnosis and we had a treatment plan. As a full-time working parent, this is a great opportunity for our community to be able to utilize this resource moving forward.
The goal of school-based virtual care is to keep kids really where they need to be. And to do that, we need to be able to offer medical services as well as therapy services within the schools themselves. And that's what our program allows.
At Atrium Health Behavioral Health, we provide school-based teletherapy for middle and high school students struggling with anxieties. They may say that they are feeling sad. Some may be dealing with difficulties at home. We provide them with a safe place to process feelings and teach them adaptive coping skills. I had a student that was referred by the school counselor because she was having suicidal thoughts upon returning back to school. Because we were able to meet her daughter where she was in her school environment and contact mom as needed, she's able to thrive.
The school-based virtual care process is very straightforward. It starts with the kid expressing that they don't feel well, usually telling their teacher, who then refers them to the school nurse. The school nurse then does their own independent assessment to determine if they feel our services are needed. They reach out to consent and ask the parents if it's okay for them to use our services, and to also ask if they'd like to be involved in the visit remotely. After that, a telepresenter is deployed to the school. When the provider is ready, they join the virtual visit and the telepresenter activates the device that is used. This device allows us to see high-resolution images of the eyes, inside the mouth, also inside the ears, and then to also listen to heart and lung sounds. After the visit is completed with the provider, a care plan is established. And if that involves prescribing antibiotics, they can be sent to the pharmacy. If that involves needing to be dismissed from school because they're considered contagious, the big takeaway is that if they're considered not contagious, they can be safely sent back to the classroom with minimal interruption to the child's life and to the parent's life.
When we first receive a referral from school counselors, teachers, from parents, principals, about any children that is in need, we speak with the parents for the initial intake and we speak with the child. After that, we have weekly follow-ups, sometimes bi-weekly, just depending on if they're in crisis and if we need to stabilize them. Once they are stabilized, they will go back to weekly sessions. Therapy gives them the tools to thrive, to move forward. And through that, children are able to flourish, move on, and this program has saved multiple lives.